get on to Richard now. So Richard will help fill us in on some of those issues we talked about before. So Richard.
Thank you very much for the invitation to speak tonight. As mentioned, I've had a long 40-year association with the Royal Prince Alfred Hospital as a general surgeon and doing a lot of trauma surgery. I also did a lot of medico-politicking, and having worked in the system for so long, I know exactly how it works. Vale Hospital is only 54 years old. Prince Alfred Hospital is 150 years old. So it's a young hospital. Why would you want to be tearing it down? It does not make sense. I want to mention the 2006 Upper House inquiry, which recommended that Frenchs Forest was the preferred site. It also recommended a 350 public hospital and a 120-bed co-located private hospital on the same site. That's how all the major hospitals in Sydney work, a mixture of both on the site but separate, and it works very well. But we've been lumbered with something else. Why, I don't know. It also said that Vale Hospital should be a complementary hospital, but it's never been defined properly what that meant and how it should complement the other hospital. There needs to be, as said on the movie, a business case, looking at that building, looking at the whole site, not just clumping some here, here and here. And I was told today they're trying to block off the site by Stokes' office so nothing else can be developed. That is crazy. The Upper House inquiry also said that Warringah Road had to be upgraded and Wakehurst Pathway had to be upgraded and flood-proofed. I repeat, Wakehurst Pathway had to be upgraded and flood-proofed. That was in 2006. Why has it not been done? Between 2006 and 2014, the Health Department and the politicians went to sleep. But it all changed in 2014 when they eventually announced that they were going to put out tenders for a private-public project, mixed private and public project. HealthScope was given the contract, and it's been mentioned the problems with HealthScope and its viability at the moment. It cost $600 million to build the hospital, $400 for the road upgrades, that's what they estimated. A total of about $2.14 billion over 20 years. The contract is strange. It's for 40 years, 20 years it's reviewed. HealthScope keeps treating private patients, but the Department of Health takes over the treatment of the public patients. Someone needs to explain to us what in the hell that contract means. Do they renegotiate the public patients? Do they build another hospital for public patients? It's taken them about 20 years to build this hospital, so if they're going to build another hospital, they need to start planning now. Despite all this, the new Frenchs Forest Hospital is a state-of-the-art, first-class facility, and we're lucky to have it. We've got to make sure that it's used properly. It's very important that we have state-of-the-art, first-class facilities. It's got 14 operating theatres, 2 cardiac catheter labs where they'll be able to put in stents, 4 procedural rooms for colonoscopy and other procedures, a large 50-space emergency department, critical care, 500-odd beds, ambulatory care, state-of-the-art diagnostic facilities, maternity, paediatrics, etc., a large mental health service. The transport infrastructure, as we know, is not finished, and it won't be finished, and they're going to open it into what is virtually a building site, and it's going to be a building site for the next 10 years because the Northern Beaches Council precinct plan, they're going to put 20-storey buildings all around it. So it's virtually going to be in a building site, which going to make it very difficult to access for the next 20 years. It's a level 5 hospital. North Shore is a level 6. There's absolutely no reason why it should not be a level 6 hospital. It has all the facilities, it only needs the staff and the funding, and the department will not fund it. There was absolutely no reason why we have to go to North Shore, travel all that way through traffic without even a helicopter service. There needs to be a helicopter service down in Pittwater. All patients in the emergency department will receive the same treatment. That'll be free. If admitted, they may use their private health insurance to become a private patient. Private patients will have an upgraded room with better TV and a choice of doctor. What are the problems? Well, they will not take major trauma because there is going to be no major neurosurgery operations. There's the golden hour when you have major trauma that you've got to get to hospital. You can be resuscitated with the ambulance, but there is a golden hour. The quicker you get to hospital, the better. I mentioned the cardiac surgery and whether they're going to do that. And once again, that's a matter. Are they going to fund the public patients to have their cardiac surgery there? Stroke unit. There was a stroke unit in Manly, but we were told that at the Northern Beaches Hospital, if you get a stroke, you either have a clot or a hemorrhage in the brain. If you have a clot, if you give the appropriate thrombolysis treatment, within 3 hours they can dissolve the clot and you can completely recover in a lot of cases. It's only not all the patients, it's only a minority. All the facilities are there to diagnose whether you've got a clot or a hemorrhage. Why they won't have thrombolysis is a mystery. And by the time you get to North Shore, time will have run out. And accesses, which we mentioned, is a major issue. Ambulance access is a problem. The roads are a problem. The buses, it's quite simple what to do about the buses from Pittwater. We've got buses going from Pittwater to Manly all the time. Why can't they divert a few of those up here? It solves the problem both ways, from Manly and Pittwater. It's too simple. They've called Vale Hospital a hospital. It is not a hospital in the true sense of the words. It is a health care facility. A hospital's got to have a casualty department, it's got to have beds, it's got to have operating. And this is giving people a total false sense of security. They think they're going to a hospital, they'll get looked after. What's going to happen at Mount Vale is they can get community service, palliative care and aged care facilities, and the acute care service, which is really an upgraded GP plus service. And we've seen the red things on the thing. You go there if there's nothing wrong with you. If you're serious, you either get yourself to the Northern Beaches Hospital or you call an ambulance. Call an ambulance, you'll get one if you are lucky, as we have heard. And it even tells you if you're having a stroke to go to the Northern Beaches Hospital. But the Northern Beaches Hospital is not equipped properly to deal with strokes in this day and age. It must be staffed by doctors and nurses who have training in emergency medicine. It would be ideal for it to be staffed by the staff from the Northern Beaches Emergency Department and just rotate them around, and that's quite. And we have to insist that that happens. They see over 30,000 patients a year. At the moment, they say they're going to have 2 doctors and 2 nurses. They'll be inundated because most of the things are actually minor. They're not, the major things happen, and they've got to be able to deal with them. And they've got to have the staff there. If you end up having a coronary, an anaphylactic reaction, what's a minor asthma attack? I have got no idea. It's an asthma attack. You have to have staff there that are trained to resuscitate and send the patients off. Now, Stokes announced today, funny, or yesterday, they're going to move the ambulance station there. Why announced it today, I've got no idea. But they've announced it before. I think that's a good move, because if you're going to have that there, you've got to be able to get patients out. So I myself think it's a good move to have the ambulance station adjacent to that hospital. But the other problem with the ambulances is, as we said, Avalon Ambulance Station is not an ambulance station. The ambulances come there, they pick up their ambulance, off they go driving all around Sydney. Same as the other thing. That is not acceptable. They have to stay within Pittwater. And as we've heard, there may be no ambulances here at all. So something has to be done about that. The problems are with the Northern Beaches Hospital, no major trauma, cardiac surgery has to be sorted out, has to be a proper stroke unit that can treat all patients with stroke in a timely fashion. The funding contract needs to be sorted out. What in the hell happens in 20 years to the patients? And as far as the Mona Vale hospital site, I repeat, it is not a hospital, and they should take that out of the wording. They can call it a palliative care hospital or a rehab hospital, but it is not a hospital, and that is quite frankly fortunate. I think I've dealt with most of the things. If anybody has any questions later, I will be pleased to answer them.